Thank you, Madam Speaker. Premier, if they're not filling out those access cards, it's very hard to monitor them in the population. My question is to the Premier. Premier, yesterday you announced a $420 million stimulus package, but only $6 million of that will go to supporting Tasmanians experiencing hardship. We agree the economy will need help as a result of this pandemic, but like many Tasmanians, we are worried about what happens to the most vulnerable in our community in the event of a wider outbreak and shutdown. Have you put as much energy into planning for the elderly living alone in the community who are dependent on outside supports? What about people with disability, wholly dependent on carers who may fall sick? St Francis Learning Centre, for example, Premier, has put out a call for essential grocery items for the low-income families they support. This pandemic is already biting the poor and disadvantaged, and the economic impacts will spread to every part-time and casual worker, every low-income family in Tasmania. Premier, the West Australian Government has frozen all household fees and charges, including water, electricity, public transport fares and vehicle registration. Premier, do you acknowledge your government will have to do the same to ensure Tasmanians aren't driven to the wall, go hungry or are made homeless in the months ahead?
Thank you. The Honourable the Premier.
Well, Madam Speaker, I thank Ms O'Connor, the Leader of the Greens, for that question and her interest in this matter. You're absolutely right. We did announce a stimulus package yesterday. In fact, its total was $420 million. In fact, it was a stimulus and support package. Now, a considerable part of that was to ensure that our public service has all of the necessary resources over coming years, and it can be completely focused on what it's doing. And so I removed the efficiency dividend, which provides around $260 million worth of additional spending directly into our community to support agencies to go about their work. In terms of the support package that we have announced in terms of those individuals that require additional support in the community, you would be aware that we yesterday made $1 million available to the
$1 million out of
$1 million available
million.
Again, and make the point. I've always said that our response would be proportionate and scalable. Proportionate and scalable. At the moment, and I think, again, most Tasmanians understand this, we have 7 positive cases. 7 positive cases, and I think just looking at the Health Minister, I think Dr Beach said that 4 of those. Yeah. 7 positive cases, and we have
7 confirmed positive cases, is what you meant to say.
Health Minister knows that's not going to be the end of it.
We are providing a proportionate and scalable response. An initial $1 million to organisations such as the Salvation Army, the Red Cross and to rural business TAS.
Madam Speaker, point of order. I'm really resisting taking points of order at the moment. We do want to hear the Premier's answer. The issue is that we don't need a restatement of the ministerial statement from yesterday. The question is, how will the government cope with, deal with, respond to vulnerable people in the community, including people living alone with disability and who are elderly? And is the government considering measures like the West Australian Government has taken to ease the financial pressure on low-income Tasmanians?
As you appreciate, that's not a point of order, and I do think the Minister is trying to get to it.
Well, thank you, Madam Speaker. Look, I think in response, your question was, what are you doing for vulnerable people? And I'm outlining what I announced yesterday, which will go towards to supporting the very people and groups that you were talking about, which you ignored in respect of that response a moment ago.
I didn't ignore it.
So, Madam Speaker, I think it is reasonable. I think it is reasonable to explain that we are taking steps, and as I've said, that are proportionate and scalable. $1 million to organisations to support vulnerable people with food, medical supplies, counselling. A further $1 million, Madam Speaker, to ensure that we can support people that are in emergency accommodation, or for those that are forced to stay away from their normal residence as a result of either somebody being in self-quarantine, Madam Speaker, or for other purposes. We're providing one-off emergency payments of $250
That
for individuals
is bugger all.
and up to $1,000 for
nowhere near
families
enough.
who are required to self-isolate, Madam Speaker. Madam Speaker,
Order, please.
Madam Speaker, in terms of, we will work with those people that are affected in our community. And as I indicated yesterday, in terms of the emergency payments, it is uncapped. It is uncapped. We will spend and invest what we need to assist in those areas.
WA government's example?
But again, Madam Speaker,
France?
Madam Speaker, there will be more that the government will need to do. There will be more that the government will need to do. This situation is not going to get better for a while.
A long while.
For a while. In terms of, and I think, for some people, and again, I've seen some comments in the press and on Facebook about, it's 4 weeks or do this for 2 weeks. We need to be sensible. We need to be calm. But this will be with us for some time, longer than 6 months. And in terms of the social distancing measures that we've been talking about, in terms of the things that individuals can do, it's important that they heed the message and they do what they can. That they ensure that they wash their hands often. Ensure that they take on board the information about social distancing and ensure that they are mindful when they are in public settings. All Tasmanians will need to work with us and work together as we work our way through this. I said yesterday...
To announce a suite of fee relief measures.
I said yesterday, Madam Speaker, that the package that we announced yesterday was the first step. We have a budget coming up in a couple of months, and we will make decisions as we move towards that as to what level of response is required at the time. But it will be proportionate, it will be scalable, and importantly, it will support those people that need support.